Hi, my name is Megan Fox. During my presentation, I will be talking about Ehlers-Danlos syndrome, also known as EDS. So what is Ehlers-Danlos? It is a connective tissue disorder that is rare, and it is a hereditary disease. So what made me choose this topic is my mother-in-law, my husband, and my daughter have Ehlers-Danlos. This disease, it affects your joints. It causes a lot of joint pain. It affects your blood vessels. They are very fragile, very elastic. It also causes problems with the skin, as you can see in the bottom right corner how elastic her skin is. So what effects does Ehlers-Danlos have on the body? Ehlers-Danlos causes a lot of chronic pain, joint musculoskeletal pain. It causes fatigue, joint dislocation. I'm going to talk about the joint dislocation for just a minute. So it's not something that happens from contact. The joint dislocation, you can be lying in bed and roll over and your shoulder be dislocated. You can be walking down the road and your ankle will dislocate. It's something most people with Ehlers-Danlos suffer with. The scarring, we all have scars most likely, but people that have EDS, they scar very easily. They bruise very easily. They'll have just a small scratch. Most people that would be gone in a couple of days, it lingers and scars and stays for a long time. You can see a picture in the bottom corner of a scar. It also becomes a problem if you need stitches. The skin is so elastic, a lot of times the stitches will not hold. So how is Ehlers-Danlos diagnosed? It's mainly on a scoring scale, and if you'll look in this top picture, this kind of is an example of what they go by. My daughter was diagnosed through a geneticist when she was 4. It's a 1 to 10 scale. Most of the time, most people at least score an 8 on this scale. The main big question is, do you have a family history? Most people that does not have a family history of Ehlers-Danlos, they don't have it. It's something that is, most likely if your mom has it, you're going to have it thing. They get you to do all these different things. They'll ask if your thumb can touch the back of your hand. You can see here how this guy, his elbow, his joints are very flexible and is pointing downward. This lady, she can touch the floor it's very important, most people can touch the floor bending over, but people with Ehlers-Danlos can have their knees locked and still touch the floor. And now you know how EDS affects the body, how it is diagnosed. We're going to go on to the next slide and see how it is treated. So it's important to diagnose Ehlers-Danlos early. So Ehlers-Danlos is not curable. It is something that can only be treated. So diagnosing at an early age is helpful because if you have Ehlers-Danlos, it's not a good thing to do gymnastics or be in dance, especially ballet. It puts a larger strain on your joints and your muscles, which causes the chronic pain. So if this is caught early, you can avoid some of these things that will only do your body more harm. Pain management is really the only way to treat, and that can everyone is different. So that can be through medication. Physical therapy is something that is used a lot in Ehlers-Danlos patients. It helps strengthen the muscles and the tissues and the ligaments and around your joints. Support devices are also something that's used. Braces, something that will support your joints that are loose. So even though Ehlers-Danlos is treatable, it still causes a lot of pain in patients. The pain can be so severe, it affects daily activities such as work, sleeping. It results in a reduction of quality of life related to health. In the research that I did, patients diagnosed with Ehlers-Danlos syndrome recorded a pain incidence of 100%, and that was conducted in a study with 28 patients, and all of these patients were experiencing pain. And usually where you have such severe pain, it does cause a lot of tiredness, a lot of fatigue. And every EDS patient is different. Their pain can be severe pain that is constant, or it can be very mild pain. An example, my mother-in-law, she has pretty severe pain and a lot of tiredness and fatigue, versus my husband, he has joint pain from day to day working. It does affect his work somewhat. It's not fun to work and try to provide and be in just pain, but he manages through it. My daughter, she's pretty young, so she doesn't really complain of joint pain a lot. What led me to taking her to be diagnosed was she scars easily, bruises easily, and is very flexible. And evidence does suggest that patients who undergo routine exercise intervention improve their physiotherapy outcomes over time. EDS patients nursing the underlying condition is often essential. Cushions may be used to alleviate pressure and pain when operating, sitting, or sleeping. So diagnosing early, pain management, and support devices are all very important in treating Ehlers-Danlos syndrome. So this pretty much sums up my topic. I hope you learned something from my research and my presentation. Thank you so much.